Maverick PT, we're going to build on in episode 2 here from what we did in episode 1 in terms of going after kind of the anterior chain of kind of the hip, anterior kind of the medial kind of hip complex, the anterior chain of kind of the lower to the upper trunk, the axillary space, thoracic spine, scapulothoracic joint, glenohumeral joint. Really important in terms of getting this and feeling and understanding why the body is an integrated unit and works together. So in episode 1 we went after kind of this posterior anchor of the tubing. So the tubing anchored straight behind us. In episode 2 we're going to go posterior lateral due to the fact that the body is driven and thrives upon driving with these directional, dimensional drivers with a lot of good kind of angulation. And so we're still going to go same high, and that's going to be left up to you a little bit in terms of what you're feeling and with regards to kind of a great kind of mob and kind of a great stretch. Again, I get in with my hands with these FMR techniques, and I will drive get my hands in kind of the hip. I'll get my hands in on thoracic spine, the scapula. I'll get my hands in on the humerus, and a combination of all the above at once to get the desired motion that I need. So we're going to go with the right arm yet to keep things consistent, and we're going to go with this left kind of posterior lateral anchor so that I'm now kind of driving myself with these lunges from the bottom up, but that this top down anchor is driving me kind of rotationally and kind of in the frontal plane, a side to side motion. So what we're going to start with, just some good kind of anterior lunges. And so I love how this attacks the abdominals. I love how it attacks kind of the anterior hip complex in that TZ2 position. I love how it attacks the groin bilaterally. I love how it attacks the hamstrings as we disassociate all this vigorous kind of massive areas of connective tissue. We're going to go a right anterior lunge now. Sometimes we'll add a little frontal plane kind of driver right here. I'll get back in the picture so you can see me a little bit better. With the right leg, we're going right anterior lateral. Typically won't kind of bug myself a whole lot with the left anterior lateral unless I'm using a left upper extremity driver here. Get a little more side bend, walk away a little bit. And then I love to go with the anterior kind of medial lunge. So the left anterior medial lunge right here. Boom, boom. And that's just really shred down up kind of these anatomy-like trains and meridians right here. So now we'll disassociate thoracic spine, scapulothoracic joint from the hips a little more. And again, I can really feel this chew in to the hips, hip capsule, trunk. So really disassociating, being helped in a dissociation of the hips, pelvis from femur, from thoracic spine and lumbar spine. I'll go with so angulation wise, I'm going to go with kind of the same side frontal plane lunge with an opposite side upper extremity kind of reach, which I'm fixated in with the tubing. Left arm in the frontal plane can kind of swing or it can kind of reach. And then we're going to go with an opposite side kind of frontal plane lunge right here. This upper extremity driver. And go with a pendy or just kind of this reach. And now I'm going to go a little opposite side rotational lunge. Little opposite side rotational lunge. I can really feel that. Really dig on in. And now we're going to go angulation wise. Let's see. Boom. So what I'm going to do next we're going to set ourselves up for the same side kind of rotational kind of lunge. I'll turn myself a little bit more, and I'm basically taking a 135-degree angle lunge, and my left upper extremity to drive and kind of reach where my foot is going, which is posterior lateral. There you are, guys. Play around with those. Those will unwind those fascial trains. They'll attack the hip complex, that anterior, that inferior medial hip joint capsule, and some of them kind of that inferior and posterior lateral hip joint capsule, as well as attacking the glenohumeral joint, scapulothoracic, and thoracic spine. Take those for a spin. For all of our athletes, people that need to propel stuff with the upper extremity, the hips, to be able to throw and to hit, these are super phenomenal activities to jump into. Go ahead and play around with these guys. You'll love them.